Good morning, Central Texas. Welcome to KISS Community Connections at My KISS 1031. I'm Phyllis Jones, your host, and we're going to have fun today, a part of the day, because I have two guests that's going to help us think not the same way, but they're going to help us with our COVID issues of the state and the medical profession, because they're kind of not friends right now. I'm not talking about the people, but I'm talking about our state and our medical community. They're kind of on different wavelengths, which is causing some confusion in our community. So we're going to help that this morning. But first of all, I can't do the show, and none of us are doing the shows. We can't forget about what happened on Monday, and we can't forget about what's going on. My question is, why is America surprised? I don't know, because, every time there's something happens, it happens for so long, and then there becomes the it. And that's it. Well, last week, when what happened to Floyd, when it happened, he was the it. It just happened to be the it. And the violence, I don't like the violence, but America has taught us violence, if you think about it. Because that's what you see when it happens. When a cop shoots an African-American male or female, whatever, it's violently. It's not nicely. It's not a nice thing. So America has taught us violence, and we need to understand that. And from that, we need to learn. There's some things we need to do. Because if we want these things to stop, then we got to take action. Sitting back looking at television is not action. Going on Facebook saying I'm sorry is not an action. It's something, but it's nothing, actuality. But we need to start taking some proactive steps if we want these things to stop. If we want these things to continue, then don't do nothing, and they won't. And Bell County, because I live in Bell County, and most of us do, don't think that you're excluded from this. We need to understand. Bell County has set a stage, just like Minnesota set a stage. Just like these other cities have set a stage in other counties. Well, Bell County, we have a stage. And our politicians and our people in offices, you need to understand that we have a stage. And I'm going to tell you what our stage is. First of all, I'll say in the city of Killeen, if you're a no-knock and you're black, you're either going to die or you're going to jail. It's proven. There's only been two, and there have been more than two in Killeen. There's been a lot of them in Killeen, but the two that were with African-American men, one was shot and killed, no gun, nothing at all. And the other one, he's in jail. He's been there for 6 years. 6 years. 6 years. No trial, but 6 years. He's supposed to have a speedy trial, but he's been there for 6 years. In Temple, guy driving from a parade, police shoots him from the passenger side of the car. So Bell County, we've set a stage. What the play is going to be, it's up to Bell County to figure out what the play is going to be. But we've set the stage, so don't think this can't happen here, because it very well can, because we're allowing it to happen. And the reason we're allowing these things to happen is because we don't talk. And the reason we have politicians who, they don't talk about it either. They'll say, I'm sorry, which attributes to nothing, because I'll say, I'm sorry your dog died, but I really don't care about your dog. But I'm going to just generally say it because it's nice to say. So saying I'm sorry is not it. We need our politicians to start talking about it. We need people to talk about it, because, see, what we do is we put it under the carpet. Like we put domestic violence, we put it under the carpet till it got so high we had to fall over it. So now we're saying something about it. So we need to say something about it, because the carpet's getting bigger. The stage is already set. We are here to decide what's going to be played. So are we going to play it out, or are we going to dismantle the stage back down to the ground so that it doesn't exist? But it's our choice what we do. So we can either be on the other side of when is it going to be, or we can see what we can do to come together and fix it. And it starts with, unfortunately, your politicians, because they vote. They're voted in. And you got to remember your politicians of what I tell you. Politicians lie to you when they say they're going to speak for you, because if you haven't talked to me, you can't speak for me. So you're not on Capitol Hill for me. You're not in Washington for me, because you didn't talk to me, so you don't know what I want. But we also need to remember politicians and your elected officials, they work for you. You do not work for them. You bring them in, they mess up, take them out. Just like your mother, well, some of our mothers say, I brought you in, I can take you out. Tell your politicians and your elected officials, tell them the same thing. I put you in, I'll take you out. If they don't do what you say, take them out. But as far as this violence is concerned, when they're running for this year, because this year Labor Day starts the actual kickoff day. Why? Because union, we said so. Anyway, I had to throw that in there. But when they're running and when they're talking to you, if they don't bring none of this up, don't vote for them. I'll say, for me, if they don't bring this up, then obviously they're not talking to you, are they? Because this is what's going on. So if they don't, and this year, nail them to the wall. Don't ask about taxes. That's craziness. If you're gonna raise my taxes, who cares? I want to know, are you gonna stop the police shootings? That's what I want to know. Raise my taxes is not your decision. You got to vote with a bunch of other people. But what are you gonna have something on the plate that deals with now and today? And this week showed us our politicians need to learn to talk about today. Because if they don't talk about today, we're gonna be the it tomorrow. We really will be. So if my soapbox is, we got to be careful. If the violence starts, don't join the violence. Please don't do that. But I want you to always to remember something too. Unfortunately, now we've came to a day and a time where we African Americans must teach our children and grandchildren something that we never wanted to teach them before. I have 3 grandchildren. Unfortunately, I have a grandson. Not unfortunately, but today's standards, unfortunately, I have a grandson. So what I've told my grandkids, and my kids are older, so I didn't tell them, but I should have probably. But I've told them, if you get stopped by a white police officer, be prepared to die. That's something I should never have to tell my kids. Never should I have to tell them that. But guess what? I did, because I have to. Because I feel and what I see is that's my only choice to tell them. Never should that ever happen. You should not have to tell your kids, if you get stopped and the policeman is this might happen to you. We shouldn't have to tell that. But this is where we live right now. This is what you got to say. I shouldn't have to say that. I shouldn't say that if I see a white cop, I'm a judge him before he gets to me. Unfortunately, I'm a judge him before he gets to me. Yeah. Why? Because it's in my head. And it's in my mind. And am I prejudging him? Yes. And should I? No, I should not. I should treat him like anybody else. But unfortunately, cops have showed us something else. So they leave us in a way of saying, well, you know what? It's best for me not to trust any of you than to trust some of you. It's safer for me. Now, I do know some cops that don't look like me. They're cool. I know this, and I know they're cool. But the other ones that I don't know. But this is where we live right now, and I don't like it. So I need it to change. But that's it for my soapbox. And, y'all know I was going to keep it real, because I usually do. In fact, I always do. It's just that's one of my issues that I do that. So now we're going to move up to our other nightmare. Okay, we have another nightmare that's been plaguing us for a long time, and it's the COVID-19 issue. So my guest today is, and I'm going to explain when I say him, because I'm going to introduce him the correct way, but I'm going to have to distinguish him from my other guests. So good morning, Brad Buckley, Dr. Brad Buckley. How you doing?
I'm good. Good morning, Phyllis. Thanks for having me this morning.
And Brad Buckley is 2 people at one time. But we're talking to one of them. Brad Buckley would be Dr. Brad Buckley because he's a veterinarian.
Yes, ma'am.
So, but this morning I'm not going to say Dr. Brad Buckley because it's going to confuse people. But Brad Buckley also is our state legislator for District 54.
Yes.
And he holds that title real well right now. And you're up for election this year?
Yes.
Okay.
In November.
Right. Okay. Well, Brad Buckley is going to talk about the state part of us opening Texas. So, because it's a clash with the state and the medical field. One is saying this, another saying that, and it's like, and unfortunately, we're all stuck in the middle of, do I do this or do I do that? And then you have the other crazy people called CDC. They're the other crazy people because they're saying things that we not legally can't do, that if we did it, it wouldn't make sense. Such as for the school district, they wanted to put 1 kid per seat on the bus. So it's going to take us all day to get the kids to school.
Yeah, it doesn't.
So our state rep is going to have to help us readjust that part of certain things. And also my other guest is Dr. Kristine Mann. And she's been on here before because when COVID became a nightmare, she came on to relax the nightmare a little bit. So good morning. How you doing?
Good morning. I'm doing great and glad to be here. Thank you for having me.
Sure. And also we got Dr. Mann to go and talk to the homeless who had got left out. And they get left out because you just don't think of them. That's just it. But she talked to the homeless, and we went to a battered women's shelter, and they were relaxed because their thought was, if we get it, where are we going to go? What are we going to do? That was their fear. They knew about it, but their fear was, what are we going to do? What am I going to do? What? So Dr. Kristine Mann went on there and she talked to them and kind of relaxed them to let them know that their world was not coming to an end and their kids weren't going to be taken away, because that's what their thought was, that they would lose their children if they became ill. That was all they thought about, because they do know that, they don't have anybody, so what else do you do with your kids? So they had a fear about that. And you relaxed them, which was good, because COVID enough is scary, but having a family and it's just you, with kids, that's a double scare of what's going to happen, because you do know that we need to fix that too. CPS can come and take your children and put them in a safe place, but we need to relax the negative part. But Dr. Mann is going to talk about the medical side of opening Texas so fast. So first we're going to talk to our legislator, Brad Buckley. He go, why I got to be first? Okay, we're opening Texas slowly, correct?
Yes, we are. If we look back on it, if we look back in the beginning in March, the big concern when I became officially engaged in with the governor on conference calls and his team from emergency management and health and human services, basically using New York as a guide of what can happen if our health system becomes overwhelmed. The initial stage of our stay home, stay safe orders that were issued by counties and cities around the state and by the governor were to make sure we didn't overwhelm our system. And so that was to make sure we ramped up our ICU bed capacity, our overall hospital capacity, ventilator capacity, to prepare for rapid spread and to make sure that the very, very ill, had a place to go for care. And so as we move through that, by changing some rules for hospitals and by making some other decisions, and he was advised by hospital professionals and physicians on how to do that, they were able to increase the capacity. And we saw throughout the early stages of the COVID outbreak in Texas, that capacity ramped up quite well, and we never overwhelmed our systems. And so as we moved through that, the governor started to balance the stay home, stay safe orders versus the economic impact and human toll that shutdown was taking on people, from jobs to the economy. And then basically I heard someone say, and I can't recall who, was that, we were treated from COVID virus initially, and now we have to learn how to stand shoulder to shoulder with it. And how do we re-engage the economy, and how do we do so safely? And the governor from the very beginning said he was going to rely on data and doctors. And that is who has informed him the most, and he has a team around him. And now we've begun, based upon metrics and increased testing and looking at numbers of cases, he's been able to relax some of the regulations and get some folks back to work. And I think all in all, people are being very responsible. There's always going to be situations where they're not, but I think all in all, at least in the community where I travel, folks are being responsible, and they're doing their best to strike that balance that's necessary.
So my next question is, okay, we know, well, now some of us understand that the numbers are going up because more people are being tested. So I'm not going to get into the doctor thing, but we know that the numbers are going up, and we're understanding that, like I said, they're testing in different areas, different cities. They did one here in Temple, and then they did one in Killeen, and they did one in Nobleville. So we know those numbers are going to go up. But is there ever, does the governor have a top where he's going to say, okay, forget it, let's redo this, and we need to shut down again? Is that in the talks?
Yeah, well, absolutely. I think as you look at the numbers, and you look at the total numbers of tests, you look at the positive cases, but really, what they follow the most is the level of hospitalization, and to make sure that the capacity is not overwhelmed. And, that's why I think it's so important for all of us as we reopen the Texas economy, understanding the fact that if we don't do this right, it could force a situation, maybe not across the entire state, because our state is so diverse in terms of our urban centers and then our rural areas. There really are very, very different in their economies and how people interact. And so, but if we see those numbers go up and our systems becoming strained, then that's the risk we run of having to lock things down again, and that would be a double whammy blow to Texans. And as we move forward, I think what's important to look at is what are we going to do? How do we manage getting our kids back in school? One of the things, my wife works for Killeen ISD, and one of the things that they're seeing is that as we brought kids out of the classroom, basically what's happening is that the achievement gap is increasing. And so, everybody knows that kids do best in a classroom with a good teacher in front of them.
Right. Now,
how are we going to manage that as we move forward? And so we have to do that. There's a technologic divide. That this entire COVID outbreak has really peeled the onion back, and we've really exposed some of our areas where we really have a lot of work to do. And technology for our school kids is important. And I'm not talking about just let's get them a laptop or give them an iPad. That's important, but a lot of kids don't have the infrastructure. They don't have the bandwidth, the type of internet necessary to receive the lessons, and so that's something we have to work on. But I think we also have to have a clear path forward of how we're going to get our kids back in school, because you don't get these years and these months back for kids, and so we have to be very cautious, but we've got to be forward thinking on how we do that.
Okay, my other thing is I've heard. Okay, I'm on the Bell County Child Welfare Board, so we keep up with foster kids, and what we've seen is in Texas, the numbers of child abuse have doubled. That's not good.
That's right.
And so those kids are displaced twice. What I mean by twice is once they've been removed from their home, and then they got to figure out how to fit themselves in when school comes back in. Because unbeknownst to us, elementary school, I'll say elementary school because I work in elementary school. Elementary kids have things that are the I'm bad. They have different outlook on everything. And I work with the little shorties, the little people. So to them, the latest backpack is it. If you don't have the latest backpack, your life is over. But if I think about that child that's been displaced from his home, he's going to come in with a whole different thing. So we've got to deal with that. But I want the state to realize that as we do these things, our child abuse numbers, like I said, have doubled in Texas. We need to take those things in account when we think about our kids. Because that's another child that, I'm on the inside. I work with 3-year-olds, special needs 3-year-olds. The ones that we cannot teach them to hug 6 feet apart. That's an impossible lesson. There's no way CDC could think we could do that because 3-year-olds want a hug. They need that secure hug, and we're going to break through and give it to them. But I would like for the state to remember that when you all talk about, our schools, because the rules with CDC and the schools are going to clash.
What I've seen is, you could put 10 people on a bus.
Yes.
I mean, basically,
yes.
and that just isn't practical. Let's look at, and obviously we want the health and safety of Texans to be at the forefront. But let's also look at the fact that, if we don't find a way to resume some normalcy in our schools, it's a huge economic impact. Think of the folks that work for the school district.
Right.
And if we're not able to find a footing that we can stand on and bring those kids back. I've talked to some of the local JPs. The number of suicides are going up. Right. The more domestic violence, more child abuse. The lockdown or stay home, stay safe has had consequences that have seeped into our lives, and again, it's like the technology divide. It's like the internet access divide. It's the achievement gap. It's all those things that have been revealed by this, and because it's something we never would have done, we never would have contemplated this, except now that we're in it. What does it look like coming out of it? And again, I think it speaks to the fact that we've retreated. Now, how do we stand shoulder to shoulder so we can stand shoulder to shoulder with those 3-year-olds?
There you go.
You know what I mean?
Yeah,
how do we do that? And how do we bring them back? And those foster kids that are facing a huge challenge anyway, that are facing this secondary challenge, and how do we do that? And so it's going to take, talk about a conversation. It's going to take a conversation. It's going to take courage, and it's going to take learning how to be nimble. I know the schools have sort of built a virtual system on the fly. Right. And so now I think, and I love to hear Dr. Mann's comments earlier, as things change across the state, and we look at areas that may have outbreaks and flare-ups, we may have schools that have to go in and out of normal delivery.
Right.
And so what are we going to have in place so that, shut it down on campus, kids have to go home, and how do we make sure that they get what they need there? Yeah. So anyway, I think it poses some really important questions, and I know the TEA is talking about them. I know our local superintendents are contemplating it, and so we'll see where it goes. But I'm certainly engaged in that to make sure we do the right thing for all kids.
Okay, Dr. Mann, are you ready?
I'm ready.
Okay, I'm glad that you both live in Texas because we're not talking about, because it would be terrible if we're talking about two different areas. And not only do you both live in Texas, we basically kind of live in the same area because Austin and Killeen are the same. I mean, we're not like, okay, we're not talking El Paso and Killeen, that's, But, okay, you're a doctor. And so you're watching Texas opening.
Yes.
So from the medical standpoint, what is the doctor's fear?
Right.
We know you have it because we kind of hear it. So, but what is the fear from the medical side of Texas going, yes, come on, we're open?
Sure. So I want to be very clear to listeners. I was told weeks ago when I was talking about COVID-19 and about shutdowns and what we needed to do that, those doctors, they just want to keep everything shut down forever. They're never going to agree to open things back up. And let me be very clear that those of us who work in the medical field are having constant conversations about how we can create a system where we can open up safely. We do clash with some of the states, and we're talking about Texas in particular. We do clash with the way things that are being done, and I want to address some of what Dr. Buckley mentioned earlier, which is the idea that we flattened the curve to keep the capacity in the hospitals where we could manage those more severe cases. And I did a couple of videos about that. I absolutely agree with that standpoint, but there's another piece that we all need to be thinking about, and that's, let's say you are the one who needs hospital care. It's still not wonderful to be on a ventilator, even if the capacity is there and we've got a hospital bed for you. I've intubated people before. I've seen people die who have been on ventilators, and just because we have that capacity to care for you doesn't mean that this is a thing that you want to have happen to you. And so we're looking at it not just from a systems standpoint, which is super important. It was very important, the steps that were taken to make sure that we have that capacity there, that we do have ventilators available, that we can get those ventilators into the areas that need it. But we also need to think about that people are still at risk and they're still going to die, even if there is a ventilator and a hospital bed available for them. And so what we're trying to do in the medical field is not just say, how can we keep capacity down, but also how can we make sure as few people as possible get this disease and are in a position that need to be on a ventilator. And other countries have done a great job. South Korea did an amazing job keeping the number of people out of the hospitals and off ventilators, and by per capita numbers, much lower numbers of deaths. So when I'm looking at reopening, and there is absolutely going to be a path to reopening, I'm looking at the steps between opening stages. And I don't agree that the state is doing it slowly enough. I don't. I think that it's going too quickly. We need about 4 to 6 weeks between each stage at a minimum to see what the effects of that opening are going to be. And a great example is what happened at Lake of the Ozarks just last weekend. They had an opening of a water park and a lake, and they had hundreds and hundreds and hundreds of people there. And now we found out yesterday that someone in that very small space tested positive for COVID-19. They were around hundreds of other people, and that's how this virus takes hold. It infects people very rapidly. Those people affect 2 to 3 other people, and it just goes on and on and on. So, and it's going to take us several weeks to see how many of those people get infected, how sick they get, how much they take up their capacity in their hospital beds, and how many people die. It doesn't just happen within a week or two. It takes weeks to find that out. So that's where we're coming from on the medical side is, yes, we have to take steps to reopen. We're aware of the domestic violence that is happening, the suicides that happen from loss of job. And if we have a chance, I want to talk about that too. But we also know how quickly this virus can take hold and spread through the community before we know that it's there.
And I also see I'm missing a doctor. I should have realized that.
You're missing a doctor.
Because there are groups like me. You know, I'm the holistic one.
Yeah.
I think American meds kill you. So I take all African herbs.
We can have a whole show on that. I would love to have a whole show on that.
I need to invite Dr. G on the show, because I am the one that if you tell me I got to take something, I'm going to go back home, call my great aunt, say, hey, listen, this is what she said. What do I really do?
That's my job every day is talking to people who have that
who do
point
the
of view.
holistic thing?
Yes, and I'm very serious where we can do a whole show on that.
You know, because we don't believe you all. We believe a doctor's job is to prolong your death. We do. I mean, no, that is what we believe. You say pill, we're like, no. So we're going to go to the book and find out, okay, all right, got it, you know. So we have our own remedies for what we do for, we even got one because for COVID, we use what the islanders use since Jamaica and Virgin Islands did a better job. Mm-hmm. So they made their own concoction. I don't know if it's legal or not, but anyway, it doesn't matter. But it worked. I'm just saying. So yes, I need to invite Dr. G on the show because we need to talk about that, because there's a whole bunch of us. Mm-hmm. Well, you should know, and you should know. There's a bunch of us who don't believe in that we've survived all this time, because for me, I don't know what the flu is. I've never had it. I watch other people with it, and kids are always coughing in my face, and I'm cool with that. Right. Not cool with that, but I have to deal with it. But it doesn't bother me because I know that whatever they got, I'm not going to catch it. Mm-hmm. So you just reminded me, I need to have that other person on the show. So you two would fall out of the chair. Because you'd be like, she said what? But yeah, when I'm like, I need them. Okay, so yeah, I'm gonna get Dr. G on the show, so
perfect.
We can talk about things that I like. You know, we're cool with that. Okay, the other part, since Texas is opening fast, people have got the misconception that it's opening fast because everything is 100% safe. Right. So the mask died.
Yes, and that is really problematic. And for those of you who want the long version about what I'm going to say, my town hall this Thursday is going to be specifically on how to keep yourself safe as things are reopening, because it isn't 100% safe. Again, going back to that example that I said with Lake of the Ozarks, that person who was around all these people had no symptoms, and they developed symptoms the next day, which means that they were almost certainly highly infective when they were around those people. They're working right now to contact all of those hundreds of people who were in contact with this one person. They've put out a timeline of which rides they were on in that water park so that people could go back and see, was I there at the same time? And it's a nightmare for the contact tracing that we talk about. Yeah. And so as we do reopen, you have things that you personally can do to keep yourself safe. You should still be wearing a mask. And if you're going to be in a place with a lot of people in a confined space for a long period of time, that's a perfect scenario of where you should be masked. You shouldn't be there if you can get away with it. And if you have to be there, you should be masked. So there's an interplay between something called dose, the dose of the virus that is required for you to get infected. You don't just get infected because you get one virus particle on your hands or face. The number we're looking at right now is around 1,000 viral particles, and that function is a function of the amount of time that you're around that person who has the virus, and how close you are, and how much interaction you have with that person as to whether or not you meet that threshold of getting enough virus to infect yourself.
Okay, so we'll go back. Okay, first of all, one, I am a certified contact tracer.
Oh, great.
I did that. Took the certification. It was easy. Some of the questions threw me off because I've been listening to the state and doctors. So some of the questions, if you take the course, some of the questions are going to throw you off because you listening to the medical and the state. So some of the questions you go, no, that's not what they said. Okay, because contact tracing says 15 minutes with the person. Is it? It says the test and the answer is 15 minutes.
Right.
If you've been, that's the longest and the short, the longest that you can be with the person. So if you're with somebody 15 minutes, then you're, and they already have it, you're in danger.
Right.
So they put it down to the minutes, but that's not what the medical community told us.
It's not exactly, it's not the same thing is the issue. So when you're a contact tracer, you have to have parameters and criteria that you use to decide who to follow up with. But that's not going to catch everyone.
Right.
You have cases where you could be in a situation with someone for longer than 15 minutes and not get infected, and you have situations where you could be in contact with someone for shorter than 15 minutes and get infected. But in order to train people to do the work, you have to set up some sort of parameter, some sort of guideline to be able to teach them how to do their work.
Okay, so since we're let's talk about a gym, not a gym, a workout place. The workout places that you go to, they're open.
Yeah.
Okay, those are close contacted places.
Yeah.
I mean, I understand the state said we gotta do. I need you all to come to, because y'all gonna have to talk at the same. Okay. Okay. The state has opened up our exercising places and our workout gyms and all that. They're open. But also, as we know, those are places where you do have a lot of contact, because if you have a trainer, you have contact. You're close to your trainer. You're right there with that person. You can't be 6 feet away because you can't. It's kind of hard to do what you need to do to help them to be that part away. But at the same token, we're open, and that's a sweaty place and like that. I want to know what kind of germs are left behind, because they're open now. They're open now. Okay, I'll say Dr. Buckley. they're open, and we know that the 6 feet apart is still there. But does the state realize that that's kind of hard to do?
I think it was one of the more recent openings.
Right.
I think looking at that, and then there's requirements too. Right. I think it's important that a gym owner or fitness workout center owner understand the epidemiology of what's going on, and that the social distancing must still occur, and that I know that the workout places that I've checked in on, they've spread the equipment out. They limit the number of people. There's temperature taking before they go in. I think they're being quite responsible with that. I think that, you see people, in a lobby of a Starbucks, they may have a mask on, but they're walking right up across the screen. I mean, there's all sorts of environments we go into where there's, there's closer contact than there should be. And so I think, I think that that's important. And I think that the gym owners or fitness center owners understand that. And it's incumbent upon them to implement the strategies and the regulations that they've set forth for them to do so.
Okay, so what I need to know is, I got what you were saying. Okay. The other point is, gyms are sweaty. They are. Yeah. People are coughing, and you're there, but mostly they're sweaty, and there are places where they're just there. There are things that happen there. Right. So as a medical profession, what do you all's part on that? We've opened our gyms.
I personally would not go to a gym right now, and I'm going to tell you why. There was a case a couple of weeks ago. I'm losing all sense of time. A couple of weeks, maybe a month or so ago, of a church choir that met. And they practiced social distancing. They used hand sanitizer. They didn't wear masks. In a gym, you're not going to wear a mask. So that's why this is kind of an equivalent situation. And
why they won't wear a mask?
It was before there was a lot of mask wearing.
Okay.
And so they took the precautions that were in place at the time.
Okay.
So they did the social distancing. They didn't hug. They didn't shake hands. They just gathered for choir practice. Half of the people in that room came down with COVID-19, and they had several deaths. And so the activity of singing requires more expellation of air than does the activity of talking. So if you're at Starbucks and you're talking to someone, you're not expelling the same amount of air as if you are forcefully singing. That's the equivalent to a gym. So even if you're not sweating, the breathing that you're doing, the forceful breathing, because you're working up your cardiovascular system and you are pushing germs out into the environment more forcefully than you would if you're just standing and talking to someone without protection. That's one. The second one, though, is what you're alluding to, which is the sweat and so forth. We know that this virus is respiratory and droplet. And droplets are the other concern in a gym situation, because you are exuding body fluids throughout your environment, on the equipment, everywhere. And it's not possible for you to track down every single place that your germs are going because they're not visible, and they're not, we don't have fluorescent lights to light up all the places that those germs are going. So that, to me, a gym situation stands out compared to a hair salon or a nail salon or Starbucks and so forth. Gyms, I think, should have been one of the last things to open, along with schools, and we'll probably talk about schools more. So I have concerns from a medical standpoint about gym openings.
Okay. My other thing is I work out at home because I don't work out at a place because I don't like. Okay. As strangely as it may seem, I am antisocial. I know you're like, how in the heck is she antisocial? But I actually am. I'm better with myself. I'm an only child, and I work better just with me. The part about being social is my lifestyle requires me to do what I do. But actuality, I can stay in the house for a week and never talk to people. But anyway, one day I was working out, and I decided to see the difference in wearing the mask and not. Okay, so I do a strenuous workout. When I was wearing the mask, I thought I was going to die. I did. I'm like, this is not working. I can't breathe because I could breathe, but breathing was not easy. It got to be very difficult. So first thing I did, luckily I'm at home, I took the mask off and threw it. I was done. It was like, I'm through with this. You can't do that. So that's what my thing was with the gyms. I knew that I had a hard time because when I heard the gyms open, I'm like, let me see if you could do this. So I do a 45-minute workout. 20 minutes into my workout, I was like, this has got to go. No, I took the mask off, went and got something to drink, came back. But at that point, I got to where breathing was not exactly a fun deal. It got to be difficult. So my thing is, how are they going to do this?
Can I jump in real quickly? I want to mention that most people, when they are wearing a mask, they're not even wearing the type of mask that would actually protect other people. So not only are you having difficulty breathing with a normal mask, if we really want to make a gym space safe, people would need to be in N95 respirators. And there's just not a real way to breathe while you're exercising with one of those masks. So I'm just going to go back to, I personally would avoid gyms right now.
Yes, and so I did. Yes, I learned my lesson. But Dr. Buckley, my other question is, okay, for you, just for you as not as a person, well,
okay,
but as a legislator,
sure,
because we haven't opened everything yet. What is your fear? What place is your one fear of opening? That you think, oh my God, do we really want to do this? What's your place as a legislator? Because you're going to be sitting up there going, that's not good. That is good. So you're going to be doing that. So what place right now that is not open that would be your fear?
Well, that's a great question. I think the biggest challenges are going to be the large group gatherings,
like concerts.
Yeah, when you get people in, a lot of people from all over that have the potential, should there be an infection, to spread it. Because people come, when there's a certain act or event, people come from all over. Mm-hmm. I think those are challenging. And I think those are the things that are going to have to be thought through very specifically. And I'm as a veterinarian, I view this certainly not to the level that Dr. Mann does, but I do know a little bit about epidemiology and the way things are spread. I deal with it all the time. And so, as we move forward and we're waiting, for a vaccine or therapeutics that could be the game changer. I suspect we're gaining some herd immunity as we move along. I mean that we would have to be. Right. But I know for vaccine in my profession, we probably have seen 7 or 8 coronaviruses infect certain species. We have one effective vaccine. One of them actually caused a cytokine storm in cats, and did not do well. And so I think just saying, we're going to have a vaccine here, and I think and I think that's sort of the balance is that what we, if our standard, and I appreciate the medical expertise, but if our standards is going to be absolute 100% safety, I don't think you get there. I think there's always going to be this balance, and my biggest concern, and you certainly mentioned it, Dr. Mann, was, how do we get our kids back in school?
Yes.
And so that's my big concern. But
it is. And how do you
I hope I answered the question. Okay.
And not only that, how do you get the kids back in school?
Yeah.
Okay, we that work in the school, we're the best ones with talking about our kids. You can't do that because you're not in school every day. You can't talk to a high school teacher about elementary school because she has no clue. So our fear of getting the kids back to school is we know the kid who had colds all the time. We know that one kid, if you said cold season's coming, tomorrow he's going to have it. And he's going to come in, and he's going to come in, and little kids, I think they're taught this somewhere, how to wipe your nose from your elbow to your hand.
Even big kids.
But I don't know what to say, but kids are taught that. I mean, somewhere this comes from. And it does, elbow to hand. You're like, what in the world? So little kids aren't conscious of any of these things. One, they're not going to wear a mask. And they're not going, and we can't make them use hand sanitizer because hand sanitizer is dangerous because little kids lick first. They got to taste it. Okay, so I would make the hand sanitizer that I use, and kids can lick it and they'll be fine. But anyway, because I'm the non-alcohol based person. I don't believe alcohol should ever touch your skin, so I make my own. But when school opens, we've got the kids who once again go back and want to hug because they need it. We're gonna do it. If you all say we can't, we're gonna do it anyway, and y'all might as well fire us now because we're looking at kids and we don't want to neglect them in any way, because we might be the only hug that kid gets. Well, if we are, we're gonna do it, But it's gonna be hard to teach our kids. We can't. You stay over there and you stay over here, and also, okay, I'm gonna pick on KISD right now, really bad. Okay, KISD has somehow or another thought about they're gonna increase class sizes, correct? Okay, how you gonna increase the class size, but students got to stay 6 feet apart? That can't happen. We don't have classrooms that big. That means your classroom would have to be in a gym. Because if you got 23 kids in your room and they're all 6 feet apart, then y'all better go to the gym or to the cafeteria to have class. So right now, the CDC requirements are going to, first of all, make you deliver. You're going to deliver kids all day into school. And then after you deliver them, you're going to go back and pick them up because they never got to what they were going to do. So school won't work that way. No PE. Okay, seriously, for real. No recess outside. For real, seriously. So right then you're containing our kids. We're containing anything that they could have, we're containing it in school. And we're taught that this is the new norm. No, that can't be the new norm. It can't be, because from a medical standpoint, we're going to spread germs for real, seriously now.
Yeah, I'm really worried about school opening up. My personal opinion, and I base this on all the discussions that I'm having in medical communities, I don't think we should open back up in the fall. I don't. I think that we have other ways of addressing some of the issues that Dr. Buckley brought up and that you've brought up with domestic violence and with kids not getting enough to eat when they're not in school. We in this state have chronically underfunded the agencies that could make a difference in those things. We haven't expanded Medicaid. WIC is chronically underfunded. There are ways to address, CPS is chronically underfunded. There are ways to address the harms that are coming to children from not being in school. Increasing broadband is a perfect example. I mean, that should be, from border to border across the country. Why do we not have broadband access for every single person in this country? So kids have no understanding of physical boundaries. They just don't. And there's just not going to be a way to follow those guidelines that the CDC has put out and contain the virus when kids go back to school. The other part that I'm looking ahead about is that at some point we're going to hit this year's cold and flu season. And it's going to be just a very huge challenge to schools and to the medical community and to the school systems and the state to figure out how we're going to test and distinguish between kid who has just a random cold and kid who is in the early stages of coronavirus vaccine illness. We don't have, and hopefully we will soon, but we don't have testing capacity yet to be able to deal with an influx of flu and colds that we normally see every year, on top of the likelihood that we'll see a flare of coronavirus as people gather more and more closely.
Yuck. But I still think we need to go to school. Okay, Dr. Buckley, I have a hard one for you. You ready?
Sure.
No, he's not. He's not really ready.
Okay. Probably not.
Okay, the state. Mm-hmm. Who's in charge? I know, but I'm going to finish that one. The CDC or the state? Because right now we have the CDC with their own guidelines. Where does the state come in with that? Do you all say, this is not realistic, we can do this? Is that what you all do? Do you all do that, or do you say, hey, listen, let's go after this one, and it doesn't? Yeah. How do you all do with this? Because if they're the last say, then we're screwed.
Yeah, no, I think that the CDC job is to put out good science,
right? And
then the state is to use those guidelines that they publish to try to build policy and procedures around that. I think that's what TEA, that has informed TEA and some of their guidance. So I would say that the state will have the final say in how we move forward, using all available information that we have. And, I think, our schools, I served on a legislative task force here recently that looked in to doing some of the research and bringing folks together that run day camps. Mm-hmm. And that will be in some of our big urban centers that parents rely on for childcare during the summer. I mean, these are real issues. These are, in a perfect world, we could button everybody up and all that, but mom and dad have to go to work.
Yes.
And so, we looked at, there's been some interesting things. The Boys and Girls Clubs of Central Texas have operated 8 facilities throughout the Stay Home, Stay Safe for essential workers, first responders. Right. And they brought school nurses in to do health checks. They created 8 kids per class. Now, I am not saying you cannot replicate that in today's public schools, but I'm saying, there are those things. Or, at our upper level schools, will we be going block scheduling, half the kids one day, half the kids the next? All of that. And literally the timeline for this is very compressed because, now we've quote ended school.
Yes.
Very anticlimactic, if you will, with virtual graduations and things like that, which breaks my heart for the class of 2020. I understand why. Yes. But as we move forward, school will start again August 17th or something like that. And so, we better have, we're going to have something in place. And I think the most important thing will how we move in and out of what this looks like and what happens. I agree when cold and flu season hit here and it all, could hit at one time. How do we manage that? And that's why I think that the calls that will have to be made will be very they'll be difficult. But if we use the data, if we improve testing, what I've been, and I'm not the question asker, but what I'm concerned about is now what we're finding out where the antibody test isn't even accurate. Maybe 50% of them aren't accurate. And so some of those things that I thought would be a great way to sort of really look at, we weren't quite sure how protective people were by antibody, but if now that test is not even sound, that sort of takes a tool from us. Okay, I'd love to talk about that.
Yeah,
sorry.
That's okay. I can talk about that real quickly.
That's okay. Yeah.
There are a number of antibody tests, you're correct, that are not accurate, but there are some that are accurate. The one that we use in my office, it is 99%, greater than 99% accurate. And we've already had 2 people who were tested with non-FDA approved antibody tests that said they had antibodies, and they came and did the approved test and they did not have antibodies. So there are going to be a lot of people out there running around who have one of these non-accurate, non-FDA approved tests thinking that they are safe, and they actually are not. So this is a very valid question and a very valid idea. And so the testing is available if you have insurance and you have money, and there are ways to get the test done, but we have to invest again in making sure that we're doing the correct tests, that people are not ordering off the internet an at-home antibody test. Don't do that. Please do not do that. Please make sure if you go to a doctor's office to get antibody testing that you ask to see what their sensitivity and specificity is on that test. You need to have a test that is in the 99% sensitivity and specificity range.
Yeah. I know.
Because they do exist. But you're absolutely correct that there are a number of tests out there that are completely inaccurate and can't be relied on.
Okay, I have another question for you, for Dr. Mann. Okay, in Longview, it's a guy who was in Longview. He had COVID, and I learned a lot through the NAACP. I'm the state education chair, so that explains why I work a lot with our state health chair, and I love Carol more to death because I've learned things from her that I didn't learn from our state or you, Dr. Mann, and I wouldn't have learned that because you two wouldn't have had to tell me. You know, in a way you would, but with Brandon, I'll say his name, when he got COVID, the first test he got, the first test he got the last of March, he still hasn't got the results back from. Mm-hmm. But luckily he went to the hospital and he got tested and he did have COVID. But I think when they told him you go home and you stay home until your breathing is below 88. Okay, so when he went home, but he didn't have an oximeter at home. Mm-hmm. Okay, and guess what? The hospital didn't have any. They ran out.
Right.
So me and Carol called all around the town which is not big. Mm-hmm. We called all around where he lives in Longview, and no stores had any because they were out. Okay, so me at that point, I'm like, he's gonna die. I did. I'm like, he's gonna die. Mm-hmm. How's he gonna get his oxygen tested? Mm-hmm. I'm like, this stupid hospital. I was going off, and Carol's like, just hold up. I'm thinking she's crazy at this point. Mm-hmm. But that's when she said, you call EMS. They have oximeters. Right. And if you tell them the situation, they will test you. Okay, how many people know that? You know what I mean? My thing is, how many people know that?
Right.
Because he would have died.
Yeah.
You know what? He'd have died. He'd have died, or that I went to the hospital being some raving lunatic, disgusting. But that little bit of knowledge, that was a little piece of knowledge. But I was like, so how many people know this? Right. No. And I'm asking different people. I'm like, so if I hadn't known her, mm-hmm. I wouldn't have known what to do. So me, that's like I said, it's a little piece of knowledge, but it's a whole big piece of knowledge.
No, it's huge. And I addressed that in a different way on social media a while ago. Talking because I had so many questions about how do I know if I'm in respiratory distress and when I need to go to the hospital. And yes, checking your pulse ox is one way, but there's also something called tripod breathing, which is where in order to breathe, you have to put your hands on your knees and lean your head forward, and that's the tripod, the two hands and your upper body, and you can't breathe unless you have this kind of a stance called a tripod stance. So if anyone is in a tripod stance that you see, it's kind of like if you overexert in exercise and you have to lean over.
You do that, yeah.
You do tripod stance.
Okay.
So if anyone is ever at rest in a tripod stance, that's a clear sign that they're in respiratory distress and need to go to the hospital.
We need to get that out. We need to tell people because, like I said, that's what you said.
It's especially useful for kids because kids, it's very difficult sometimes to have them articulate what they're feeling. They'll use words that aren't exactly correct because they don't have full language development yet.
Right.
And they don't always have insight into what they're thinking and feeling. And so that's a visual thing that you can look at. The other one is if you can't say more than 2 to 3 words without taking a breath, that's a marker for being in respiratory distress. And that's another thing that people can look for as to whether or not they need to go to the hospital.
Okay, so now Dr. Buckley. He's like, what did she say? We're on a task force.
Yes, ma'am.
So I think when we create a flyer, those things need to be on it.
That's exactly what I was saying. I mean, that's the type of information besides, the Bell County COVID-19 Racial Disparities Task Force that has done great work, that has moved, really helped to get some testing and some underserved folks in Killeen. And, those results are back. And I think one interesting note from what I've been told by Bell County Public Health, from the Killeen test and the Temple test and the Rogers and the Troy test and the Nolanville test, I believe we had 7 positives out of 300 and something folks tested. And I was really proud of the way, and I can only speak to the killeen testing because I saw it. I was proud of the way that their emergency manager really broke ground for TDEM and used hurricane phones to give to folks that couldn't communicate. Because one of the things I've had so many people contact me about, we got to test more, we got to test more, we got to test more, we got to test certain populations, and I agree 100%. But these tests are not. It's not like getting your cholesterol checked. In other words, there's a serious implication to a positive result. And so you have to have the infrastructure in place to follow up and make certain you do something about it. So, I think that's going to be the challenge as we move forward as well, as we test people. It can't just be the test. It has to be the test plus the follow-up.
Right.
And for certain folks in certain situations, that's difficult. And so, what we're working on the task force right now is try to set up some permanent testing.
Yes.
But that in itself is complicated.
Yes,
you have to have, maybe it's at a community clinic, you have to have well-trained volunteers.
Right.
You can't let just,
Anybody.
somebody off the street, a well-meaning volunteer do that. It has to be a professional that can volunteer time to actually, get meaningful tests done and then follow up on it. So it's a challenge.
But I want to add that information on the flyer that Dr. Mann just said.
The tripod breathing,
Yeah,
absolutely.
because like I said, people who can't afford anything, they can't afford to buy the meter. But they know, they can be told, oh, listen, this is what you can do instead.
Absolutely.
So I think we need to remember, like what you said, plus the meter, because if I can't afford the meter, I can do that. The tripod, I can do that. I can teach my kids to do that. Because if you teach kids to do that in a fun way, they'll actually do it when it needs to be done. Yeah. So we need to remember all the levels of people that we're dealing with.
I think another thing that's important is that, and this is another thing we faced, and our biggest hurdle to our task force for day camps, and I use that because it's kind of the mini model for schools, is that we need to have a system in place where we know just exactly the environment and whom the kids live with. Right. Because what I fear, and I know the doctor can speak to that, is the fact that they could bring that virus home to a vulnerable family member. My father is a year and 7 days post-kidney transplant. Right. Lives next door to us. And so, that's exactly, and thank goodness I don't have, we're empty nesters now. But kids that were going into that environment every day and mingling and doing what kids do, could bring that home and they want to see grandpa. Yep. And they're going to go jump on grandma's lap. That's what they do.
Yes.
And grandma wants them to do that.
Yeah.
But those are the really tough questions we have to answer as we move forward and gather that information. We have to survey the technology they have to be ready. We got to know, their home life, who they're living. I mean, it is huge issues for our schools.
It is.
And it's a lot of work.
It's a life. Yeah. Okay, Dr. Mann, before we almost wrap up, if I want to, in my house, if I want to have proper tools or medical things that I need to have, because I need to build a kit. I need one. I mean, I know our task force is talking about it. Through the NAACP, our state health chair is building a kit. I think she talked to you about it. She's building one. She can build one faster than we can. That's not fair. But anyway, I'll get into that later. But we're talking about building kits. So if I want to build a kit and I want my friends to know, what should I tell them to buy, to put together, to have in their house? So just in case, just in case, what should they have?
Are you talking specific to COVID-19 or just
yes,
in general?
COVID-19.
Okay. So, I can tell you what I carry with me. I always have hand sanitizer with me.
Okay.
I always have disinfectant wipes with me. Okay. I always have my mask with me. Those are the main three things. Beyond that, the tools are things that you do, like sneezing and coughing into your elbow, which we sort of alluded to earlier. Maintaining distance. So everything else is an activity, but in terms of equipment, the things that you need to have, mask, hand sanitizer, and disinfectant wipes. The pulse oximeter is a great thing to have if you can afford it.
Right, they're not expensive either.
They're not that expensive.
I found that when I bought one, yeah. Yeah, and the thermometer.
Yeah, a thermometer, yes. That's a general, I think everybody should always have a thermometer because I'm continually asking people what their temperature was when they were home. So, yes. But specific to COVID-19, those three basics plus a pulse oximeter.
Okay. Now the gloves.
Yeah.
Whew. The gloves. The gloves become a difficult task for certain people. One, okay, me, when I pump gas, I do wear gloves.
Yeah.
And I know how to take the gloves off so that my hands don't touch the outside of the glove before I toss it. Talk to us about the cross-contamination of gloves, such as the people who go, they're going to go to H-E-B with a glove, then they're going to go get glass and put the same gloves on again. And then they're going to go get something to drink, or whatever. And once again, they're going to, so they've worn these same gloves during the whole outing of their house. They got on the same gloves. So what have they just did?
I personally have seen no one use their gloves properly other than people who are trained medical professionals. I'm just going to put that out there. I'm so sorry. I love everybody, but you're not using your gloves right. I actually don't do the things that you're talking about. I carry my hand sanitizer, and you've seen me as I'm sitting here. I've used this 100 times. Right. That's habit for me. That's habit for me over 20 years of doing medicine. I use my hand sanitizer before I talk to a patient, after I talk to a patient, before I touch them, after I touch them. After I touch the keyboard in my office, I hand sanitize myself. After I touch the door and I walk out the room, I go and I hand sanitize. So I know, and I'm in the habit of anytime I touch a surface, I'm grabbing that hand sanitizer, and I feel dirty if I haven't used it. Like it's so ingrained into me. So gloves are giving people a false sense of security, in my opinion, because if you're not treating your gloves just like with your hands, where you're changing it every single time you touch something, you're not doing yourself any good.
All right, and I want to thank you two for coming on. But as we close, I'll give everybody my recipe for hand sanitizer with no alcohol. And Dr. Buckley and Dr. Mann, y'all don't hear what I say. Actually, what I'm saying is legal. It's not illegal, but in other words, okay. To make hand sanitizer, you use one aloe vera gel, and you can use rubbing alcohol. You put them in a bowl and you mix them to the consistency that you like. If you want to use an essential oil with the hand sanitizer, that's fine. Just put a little bit in there, and it gives it a scent. Okay, so that's for you alcohol people. Okay, then you have those of us. I use everything that's natural, and nothing touches my body unless I make it. If I don't make it, I'm not using it. And that's me. That's just a me thing. But if you want to make a hand sanitizer and you do not want to use alcohol, you do same thing. You get a bottle of aloe vera gel, put it in a bowl, but you buy some Everclear, to which you get at the alcohol store. Everclear, first of all, is distilled. It is safe, but it doesn't have any alcohol in it. And it does not smell like something you drink. So if the police stop you, they're going to still just smell alcohol. But I use Everclear, and a lot of us who do all natural things, we use Everclear instead of alcohol. So you would do the same recipe, we just use Everclear instead of alcohol. So we say it's a better hand sanitizer. Dr. Mann probably said, no, it's not. But anyway, we believe that it is because it's not using alcohol. So those are the two that's out there, and you can make your own hand sanitizer, and it's still safe. It still works. And, it's right now, unless you order it offline or whatever, it's going to be hard to find hand sanitizer. So you can make your own. And every week I say this, people forget to write down what I said and then tell me again, say it again. So I do. So those are the two ways that you can make your own hand sanitizer. And it's just based upon the fact if you're a person that uses alcohol and not. I'm not going to ever say don't use it. If that's your preference, go ahead. But if you're one of us natural people, then you don't, and you'll use Everclear or something else. But I want to thank you two for coming on the show. Unfortunately, y'all gonna have to come back because as the weeks go on, you both will have more information. But the next time, I'm going to invite that third person, and I'm going to invite Dr. G because she's an all-natural doctor.
Looking forward to it.
Thank
you.
Her and Dr. Mann can both faint in the floor, and Dr. Buckley would be like, I don't know what happened.
Yeah. Thanks for having me. It's been a pleasure being here. And as always, I want folks, and we talked about earlier about reaching out on all issues. It's important, whether it be COVID and or issues that involve the unfortunate incidents this week. Reach out to local officials, reach out to my office. Let me know what you're thinking. And that's what I'm here for. And I appreciate the opportunity to be here. Thank you.
Of course, because we have to, when we don't talk about things, they get worse. They do. They get worse. When we say, I'm not going to talk about it, then it gets worse. And like I said, then we fall over the carpet because the dust on it is so high. So we need to talk about COVID. And COVID isn't going away, unfortunately. There are those of us who are lucky. And I'm saying I'm not going to get it. I'm not. I'm just not. There's no way. And me and my family. And the medical thing, Unfortunately, I have 3 medical people in my family. It is not fun, okay? It's not fun having your child be in the medical profession because she assumes that she's your mother at that. Yeah, it's not fun. And having a granddaughter, no, see, those are not fun things in life. I'm wanting to let you know, having 3 medical people in your family is not fun. It's nice, it is, and it makes you proud.
I feel attacked right now, Miss Phyllis.
I'm just saying. I'm just saying, you know. I'm just saying that, you know, I don't have any political people. We're all activists, so we're other side, because political activists cannot be politicians. I don't need to say that. We're not built that way. Because, you know, we have that forceful thing about us, and we're confrontational. I know I said it that I'm an antisocial, but I am confrontational. I can't help that. It's my life, and I was raised that way. But anyway, I want to thank you all for coming on, and the conversation we had is very important. I hope people took notes, because if you didn't, we'll have to play the show all over again, because it's important that we keep the conversation up. It's important that we all work together. We need to understand there's no this side over here and that side over there. No, COVID doesn't say that. You know, COVID didn't say, I like these people and I don't like those. It didn't say that. It said, I like everybody. So we need to come together as a people and just talk about it. And when we disagree, that's good. Because you know what? When you disagree on stuff like this, then guess what you're going to go do? You're going to go back and research, and you're going to go read. Because you're going to try to figure out, how did y'all disagree? So that's even good. I like the fact that, okay, Dr. Buckley, Dr. Mann says something. He's like, And he said something. She goes, well, that's good. Because you know what? Now they're going to go back. They got to go back and research it and go, okay, I understand. I might not like it, but I understand. Like Dr. Mann said, schools shouldn't open. Yes, they do. Because those short people need to be in school, because kids learn better in school than they do at home. Because at home, I can break away and go eat, look at TV. Yep. Then I can come back. I'm too full, so I'm not going to concentrate. So no. But we've had a great time this morning and talking and what we need to do. But I want everybody, first of all, to be safe, stay safe, still wear your mask. If you go to any of the events tomorrow, wear a mask. When you're at the rally, wear your mask. Just don't breathe as much. But do wear it and make sure that you stay safe. And like I said, remember, while we're at the rally, COVID is still there. Still saying, hi, how you doing? What's up? It's still talking to you. So while we're there, wear a mask and wear a mask again. Bring your hand sanitizer with you. Don't use anybody else's, because you don't know what it is. But make sure you have it with you. And there's no proper company that doesn't make good and all. So just buy some hand sanitizer. Be equipped, be well, stay safe. And you know what? You need to remember what I tell you every week. You cannot lead a positive life with a negative mind. We'll talk to you next Sunday. Bye now. 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 Next Sunday.